Good morning, everyone. We're returning to you live from MediFuture. My name is Kate Warnock, and I'm the GuideWell Social Media Manager. Today, we have David F. Carr with us in the GuideWell Insights Lounge. Welcome to the lounge, Mr. Carr.
Thank you very much.
Happy to have you. David is the editor for Information Week Healthcare, and I think he's going to have a very interesting perspective on the MediFuture events. David, you just moderated a panel on the quantified self and consumer engagement. Can you tell us a little bit about that conversation and what you found most compelling?
Well, it turns out actually that both of our panelists, we had Beth Bierbauer from Humana, as well as Christine Lemke from a startup called the Activity Exchange. Turned out that they both hate that term, quantified self, or I think it's maybe at least that it's too much of an insider term. Certainly not what they want to present to the consumers, the patients that they're trying to engage. But what they do want to do is present a range of tools that are available and to coordinate them, help people use them productively and stay on track. There's a good deal of anecdotal evidence that people sometimes start out with something like a Fitbit and they have wonderful good intentions. They're going to start a weight loss program. They're going to do all sorts of things to improve their health, and they do fall off that wagon. So how can we give them nudges along the way? How can we take advantage of their social network? And that doesn't necessarily just mean their Facebook network. It means their ties to their family, to other people. So it's really the truly social part of the social network. The real life
right? Social network, right.
So how can we engage all those people into being a team that keeps you on track and reinforces those healthy behaviors? How can we nudge you along the way? And there are techniques of making things a little bit more like a game, building rewards into the process. Those are all things that they're experimenting about. Now, the Activity Exchange is a very young startup, so Humana is their marquee customer. They don't really have a story that they can tell in terms of, based on the last year or a couple of years of data, that people are actually that much healthier because they've participated in the program. But it's something that shows a lot of potential. And I would say that probably the whole healthcare industry is at that stage of needing to do a lot of experimentation, of needing to think differently about how they can relate to patients, how they can relate to them, not just as patients, but as consumers, not just as plan subscribers, but as people. So all those things are definitely in flux right now, and there's a lot of learning going on. I've learned a few things here.
Oh, that sounds perfect. Well, I know that the consumer theme obviously has been a predominant point of reference here at MediFuture. Looking at your background, David, you've written extensively about health IT and the government, and I'm wondering what that consumer influence might be as far as sharing data and making sure that health information flows where it needs to flow. Do you think that government agencies like HHS and CMS are going to be more of the catalyst for that data and information sharing, or is it really going to be more from the consumer market?
Yeah, I think the government, the Affordable Care Act, the promotion of this idea of accountable care organizations, where you're trying to tie together the data about the individual. You're trying to tie together the experience across more of a range, do more that is proactive to understand the total health of the individual and to promote the total health of the individual. The government intervention is one catalyst. It seems to be something that industry is moving towards anyway. The government is moving towards it because healthcare is becoming unaffordable, but the commercial insurance market is finding out the same thing. So I think there is a general pressure that says we need to do something different. Exactly what that thing is what everybody is still experimenting. There's still, I think, probably a pretty big gap between theory and practice of what people want to do and what they're actually accomplishing so far.
Well, maybe as part of that, do you think the data standardization, who is really going to drive that forward? Because I think that the data that is being collected and aggregated is certainly important, but it's not useful until it really truly is standardized. So I think that there's been a bit of a disconnect across the industry, and do we have, how do we enforce that kind of standardization so that we really can begin to make sense of it?
Yeah, that's that is going to be definitely the multi-million-dollar question. I mean, a lot of my reporting has been more from the perspective of talking with hospitals and large practice organizations about how they handle electronic medical records, electronic health records, health information exchange. The perspective of this conference is actually a little bit different because it is a little bit more from the perspective of the payers and the technology innovators. And to some extent, they are not necessarily seeing that all the data that they need to be effective is actually from those EHR systems.
Sure.
So if you only go to the hospital once a year, then you're only capturing a snapshot once a year. There's so much more potential for these activity trackers, other methods of people tracking their own behavioral health that has potential as very valuable data, but it's not in the EHR. Maybe some of that needs to flow into the EHR and be available for your doctor to review. But it actually seems to be, certainly in the context of quantified health and consumer engagement, the most important thing is that the individual themselves is able to see that, and more importantly, to make sense of it.
Right.
Not just to have a bunch of statistics, but to have something that gives them an idea of overall how are these things adding up for me.
A dashboard of sorts or something that kind of makes it more consumable.
And I mentioned health information exchange. What I mean by that is getting electronic medical records from one hospital to another, from the primary care physician to the hospital and back again. That still seems to me to be a mess. And that's going to take a bit more time and both technical, I don't know if it's so much technical standards as the business formula around that still needs to evolve quite a bit. And it may be a separate question from how some of this other consumer-directed information gets organized.
Well, I appreciate your insights on that because I know that there's a lot of conversation around that, certainly within our company. I have a question more towards your editor role. How is it that you determine what is the right kind of story to publish for your readers, and what is it that you like to tweet about and know that that's something worth sharing through your Twitter feed?
Yeah, it's it is a gut call. We're ultimately looking for information that is going to be useful to people. Probably one of the most irresistible stories to me is a case study that has enough detail to understand not only that we implemented product X or took advantage of such and such cloud service, but how we did it, what are some of the project management challenges that cropped up along the way in terms of what we've been talking about in terms of consumer engagement. What are the training dimensions of that? What does your staff need to know in order to interact? So even though I'm definitely from an IT perspective, we need all that business context around it to make it not only useful, but to make it a good story.
Right.
In tweeting, tweeting is a good portion of it is self-promotional or promoting what my colleagues wrote, but I also do try and look for useful things that I see other people writing, and try and, as a good social media citizen, try to be generous about sharing things that may be from competing publications, but as long as they're useful.
Well, so you're curating content, and I think that's a valuable role, especially given your history and your expertise in your field. So I think that's the best of both worlds, really. So, well, David, I can't thank you enough for joining us here today in the GuideWell Insights Lounge. I hope that you have a good rest of your day, and look forward to hearing more from you in the future. This is Kate Warnock, Social Media Manager with GuideWell. We'll be back with you shortly with David Friedman at 9:45. Thanks so much.